Good day, my name is Sister Mbali and I'm a professional nurse and midwife. Today we'll be speaking about your healthcare visits and why each one is important. Once you've done your pregnancy test and have gone for your first antenatal appointment, which should be at least at 8 weeks, which means you've missed 2 periods, so you go to the clinic or you go to the private sector, seen to by a midwife or a doctor. From there, you will have an appointment every 4 weeks. Okay, so you'll have one at the 12-week mark, 16-week mark, and so on up until 36 weeks. And then you start to see your healthcare provider every 2 weeks up until 40 weeks. From 40 weeks, you should be already at the hospital setting or with private midwives, especially if they're backed up by a doctor and are able to do home births. They will also wait up to 42 weeks. So your pregnancy should end between 37 to 42 weeks. That's a healthy pregnancy. Anything that happens before then would be preterm. It's important to go to each and every single visit because every week counts in pregnancy. So the baby changes so much and the uterus also changes, as well as the placenta changes a lot. Having regular checks is very important so that we're able to monitor as your body will start to get under pressure as the pregnancy progresses. For example, your heart, your blood pressure when at the very first appointment could be normal, but it can happen that as the placenta starts to grow, your blood pressure starts to get higher, and it may cause complications such as pregnancy-induced hypertension, which then can lead to preeclampsia and then eclampsia, and that's when you start to have seizures in pregnancy just because your blood pressure is so high. But all of this can be preventable if you're going to each and every single visit. There are standard assessments that we would do. For example, your blood pressure has to be done at every appointment, your urine, your weight as well. If you're not gaining weight, it means that the baby is also not going to grow very well. But also if you have a higher BMI, that also can cause dangers to you because your body is under pressure and the pregnancy just adds onto that pressure. So it's very important that we are assessing at every single appointment your weight, and also some women swell up as well. So the swelling is normal because your blood volume is increasing because the body now has to supply the baby and the mom. But it starts to become abnormal as once the swelling becomes generalized. It's okay on your feet because of gravity. Like if you've had a very long day and you've been walking around, maybe you work, you've got other kids, it's very normal for your feet to swell up, but the second you elevate them, it usually subsides. But with some women, that's already an indicator that there's pressure in the body. There's something that the body is not able to control anymore, and it's usually the blood pressure. It's also very important for us to monitor the baby at every visit. So what will happen is that we will do so at 8 weeks, there's not much that they're going to feel because the baby is so tiny and even the uterus hasn't grown at all. But by 16 weeks, you'll be able to palpate, or the midwife or the doctor will be able to palpate that the uterus is starting to grow, as well as we can do what is called a symphysis fundal height, where we go from the bone in your pelvis all the way to the top of the womb. Then we're able to see if the babies are growing according to the weeks of the pregnancy test as well as the ultrasound. All these values all have to be alike. You can be 3 weeks less or 3 weeks above, and that's just to be more inclusive for women. So for example, if you are 24 weeks and you're measuring 21 centimeters, it's okay. Or if you're measuring 27 centimeters, also okay, because some women are taller, other women are shorter and smaller framed, so it tries to be inclusive of everyone. But all of these values need to be aligned, and it's also okay if you didn't know when your last menstrual period is, because as I said, there are so many different reasons why your period will not be regular. So if someone doesn't have a regular period, it's fine. The ultrasound and the measurement will give us more accuracy. Those values should be roundabout the same. The reason why it's also very important for us to monitor you, there is a condition that babies can also get, which is called intrauterine growth restriction. This is when the baby is not growing properly. Then you can also have a baby that's big. So in your very first appointment, if you don't get an ultrasound, or in the ultrasound the other twin could have been hidden, there is a reason why you would have a larger abdomen. It wouldn't just be because you have a big baby, it could be because you have 2 babies. And if you book too late, then we would have missed being able to take antenatal vitamins and a proper diet. Having supplements is so important, especially in the first couple of weeks of pregnancy. Even before pregnancy, it would be lovely if women could start before, but as sometimes we don't know when our periods are. We have irregular periods, so you wouldn't actually be able to prepare, or it could have just been a surprise. We take your antenatal vitamins, especially folic acid. Folic acid helps with the development of the baby. Calcium helps with the development of the bones for the baby, as well as for mom, because the baby will take from the mom everything that they need, and what will end up being is that the mom will end up being depleted. So at each antenatal appointment, we're able to see if you are depleted of certain things such as iron. Anemia is a very common condition that can happen to pregnant women because you're supplying blood to your baby, but if you're not eating well and you're not taking care of yourself, then your body, as I said, the baby will take from your body. So at each and every single appointment, we're able to see if your body is struggling or if your baby's taking too much, and then we'll be able to monitor that.